What are non-communicable diseases or NCDs? Non-communicable diseases are medical conditions that cannot be transmitted from person to person. Unlike infectious diseases such as the flu or COVID-19, NCDs cannot spread through direct contact. NCDs are typically chronic in nature, meaning they last for long periods of time and progress gradually. These diseases result from a combination of four main factors. Genetic factors, which include hereditary predispositions passed down through families. Physiological factors, such as high blood pressure or obesity. Environmental influences, including air pollution and workplace hazards. And behavioral factors, such as tobacco use, physical inactivity, and poor diet. The global impact of NCDs is staggering. They account for 74% of all deaths worldwide, making them by far the leading cause of mortality globally. The four major categories of NCDs are cardiovascular diseases, which affect the heart and blood vessels; cancer, characterized by abnormal cell growth; chronic respiratory diseases, which impact the lungs and airways; and diabetes, a metabolic disorder affecting blood sugar regulation. Understanding these non-communicable diseases is crucial for developing effective prevention and management strategies. Cardiovascular diseases are a major category of non-communicable diseases affecting the heart and blood vessels. Common cardiovascular conditions include heart disease, which involves narrowed or blocked coronary arteries. Stroke occurs when blood flow to the brain is blocked, causing brain cell death. Hypertension, or high blood pressure, damages blood vessels over time and is a major risk factor for other cardiovascular diseases. Cardiovascular diseases affect how blood flows through your vessels. In a healthy blood vessel, blood flows freely. In a diseased blood vessel, plaque buildup and narrowing restrict blood flow, reducing oxygen delivery to vital organs. This restriction of blood flow can lead to tissue damage and impaired organ function. Several key risk factors increase the likelihood of developing cardiovascular diseases. High blood pressure puts stress on artery walls, making them more susceptible to damage. High cholesterol leads to plaque buildup in blood vessels. Smoking damages blood vessels and reduces oxygen in the blood. And obesity increases strain on the heart and is linked to high blood pressure and diabetes. These modifiable risk factors account for over 90% of cardiovascular disease risk. Cardiovascular diseases have an enormous global impact. They are the #1 cause of death globally among all non-communicable diseases. CVDs account for 32% of all global deaths, compared to 16% for cancer. Respiratory diseases and diabetes account for 7 and 4% respectively. This translates to approximately 17.9 million deaths annually from cardiovascular diseases. Cancer is a major category of non-communicable diseases characterized by abnormal cell growth with the potential to invade or spread to other parts of the body. Let's look at the difference between normal and cancer cells. Normal cells grow in a controlled manner with organized structure. They die when damaged and stay where they belong. Cancer cells, however, grow uncontrollably with irregular structures. They resist normal cell death signals and can invade neighboring tissues. The most common types of cancer include lung cancer, which is the leading cause of cancer deaths worldwide. Breast cancer is the most commonly diagnosed cancer in women. Colorectal cancer is the third most common cancer globally. And prostate cancer is the most common cancer affecting men. Cancer develops through genetic mutations that affect the cell's growth and division mechanisms. This process typically starts with a normal cell that acquires a genetic mutation, leading to abnormal growth, cancer formation, and potentially metastasis. Metastasis is the process by which cancer spreads from its original site to other parts of the body. This occurs when cancer cells break away from the primary tumor, travel through the bloodstream or lymphatic system, and form new tumors in distant locations. Several key risk factors contribute to cancer development. Tobacco use is the leading preventable cause of cancer worldwide. Unhealthy diets, particularly those high in processed foods and fats, can increase cancer risk. Physical inactivity and sedentary lifestyles are associated with higher cancer risk. Exposure to carcinogens such as certain chemicals, UV radiation, and asbestos can damage DNA and lead to cancer. Early detection is crucial for successful cancer treatment and improved survival rates. Mammograms are recommended for women aged 40 to 50 and older every 1 to 2 years to detect breast cancer. Colonoscopies are recommended for adults 45 and older every 10 years to detect colorectal cancer. PSA tests for men 50 and older can help detect prostate cancer, though the decision to test should be discussed with a doctor. Chronic respiratory diseases are long-term conditions that affect the airways and lungs, making breathing progressively more difficult. These diseases impact the respiratory system, which includes the airways, lungs, and the muscles that enable breathing. COPD, or chronic obstructive pulmonary disease, is a progressive condition that makes breathing difficult due to inflammation and damage to lung tissue. In COPD, the airways become inflamed and narrowed, and the air sacs in the lungs can be damaged or destroyed. The primary risk factor for COPD is tobacco smoke, responsible for up to 80% of cases worldwide. Other risk factors include exposure to air pollution, occupational dusts and chemicals, and certain genetic factors like alpha-1 antitrypsin deficiency. COPD significantly impacts quality of life through symptoms such as shortness of breath, persistent cough with mucus production, and wheezing. As the disease progresses, even simple activities like walking, climbing stairs, or performing daily tasks become challenging. Asthma is another major chronic respiratory disease where the airways become inflamed, narrow, and swollen, making breathing difficult. During an asthma attack, the muscles around the airways tighten, the airway lining becomes inflamed, and excess mucus is produced, significantly narrowing the air passages. Unlike COPD, asthma has both genetic and environmental triggers. Environmental factors include allergens like pollen, dust mites, and pet dander, as well as air pollution, cold air, and respiratory infections. Genetic factors also play a significant role in asthma development, with family history being a strong predictor of the condition. Asthma symptoms include shortness of breath, chest tightness, wheezing during exhalation, and coughing attacks, particularly at night or during physical activity. These symptoms can significantly impact quality of life, causing activity limitations, sleep disturbances, school or work absences, and sometimes requiring emergency medical care for severe attacks. Both COPD and asthma are major chronic respiratory diseases, but they differ in key ways. COPD is progressive and largely irreversible, primarily caused by tobacco smoke, and develops slowly over years. Asthma, on the other hand, is characterized by episodic and often reversible symptoms, has multiple environmental and genetic triggers, and can develop at any age, though it's more common in children. Diabetes is a metabolic disorder characterized by high blood sugar levels. This occurs when the body either doesn't produce enough insulin or can't effectively use the insulin it produces. Insulin, produced by the pancreas, is critical for regulating blood sugar. It allows cells to take in glucose from the bloodstream and use it for energy. There are two main types of diabetes. Type 1 is an autoimmune condition where the body attacks and destroys insulin-producing cells in the pancreas. Type 2 diabetes is when the body becomes resistant to insulin or doesn't produce enough. It's often associated with lifestyle factors and typically develops in adulthood, though it's increasingly seen in younger populations. Diabetes affects multiple body systems and can lead to serious complications if not properly managed. Cardiovascular complications are common, increasing the risk of heart attack and stroke. Kidney disease or diabetic nephropathy is a serious complication and a leading cause of kidney failure. Diabetic retinopathy can damage blood vessels in the retina, potentially leading to vision loss or blindness. Nerve damage, or diabetic neuropathy, can cause pain, numbness, and increase the risk of infections, especially in the feet. Let's examine the key risk factors for type 2 diabetes, which accounts for about 90% of all diabetes cases worldwide. Obesity, especially abdominal obesity, is strongly linked to insulin resistance. A BMI over 30 significantly increases risk. Physical inactivity reduces the body's ability to use insulin effectively. Less than 150 minutes of moderate activity per week increases risk. Poor diet, particularly one high in processed foods, sugars, and unhealthy fats, contributes to weight gain and affects blood glucose regulation. Genetic factors play a role too. Having a first-degree relative with type 2 diabetes increases your risk between 2 and 6 times. Age is another factor, with risk increasing after age 45. Other risk factors include ethnicity, gestational diabetes history, and certain medical conditions. Diabetes has become a global epidemic, with prevalence rising dramatically over the past few decades. According to the International Diabetes Federation, as of 2021, approximately 537 million adults are living with diabetes worldwide, and this number is projected to reach 783 million by 2045. The burden is particularly heavy in developing countries, with 3 in 4 people with diabetes living in low and middle-income countries. What's particularly concerning is that approximately 1 in 2 adults with diabetes remain undiagnosed, increasing their risk of developing serious complications. While cardiovascular diseases, cancer, respiratory conditions, and diabetes often dominate discussions of non-communicable diseases, several other major NCDs affect millions worldwide. Neurological disorders affect the brain and nervous system. Alzheimer's disease causes progressive memory loss and cognitive decline, affecting over 50 million people worldwide. Parkinson's disease affects movement control, causing tremors, rigidity, and balance problems. It impacts over 10 million people globally and progressively worsens over time. Musculoskeletal conditions affect the joints, bones, and supporting tissues. Arthritis involves joint inflammation and pain, affecting over 350 million people and causing significant disability. Osteoporosis causes bone density loss, making bones fragile and prone to fracture. It affects more than 200 million people worldwide, particularly older adults. Chronic kidney disease involves the progressive loss of kidney function. It affects approximately 10% of the global population and can eventually require dialysis or kidney transplantation. CKD progresses through stages as kidney function gradually declines. It's both a consequence of and contributor to other NCDs, particularly cardiovascular disease. The global impact of these NCDs is substantial, with hundreds of millions affected worldwide. Chronic kidney disease affects nearly 850 million people, while arthritis impacts over 350 million. These conditions place an enormous burden on healthcare systems worldwide through increased hospitalization rates and long-term care needs. They also significantly reduce quality of life and workforce productivity. While these conditions often receive less attention than cardiovascular disease or cancer, they affect hundreds of millions worldwide and require comprehensive healthcare strategies. Risk factors for non-communicable diseases can be divided into 3 main categories: modifiable risk factors that we can change through behavior, environmental risk factors from our surroundings, and non-modifiable risk factors like age and genetics. Modifiable risk factors are behaviors we can change to reduce our risk of developing NCDs. Tobacco use significantly increases the risk of lung cancer, heart disease, and chronic respiratory conditions. Even secondhand smoke exposure is dangerous. Physical inactivity contributes to obesity and heart disease, while also weakening our immune system and decreasing overall health. An unhealthy diet high in processed foods, sugar, and salt, while low in fruits and vegetables, increases risk for multiple NCDs, including diabetes and heart disease. The harmful use of alcohol damages the liver and contributes to several cancers and cardiovascular diseases, even at moderate consumption levels. It's important to understand that these behavioral factors often contribute to multiple NCDs simultaneously. For instance, smoking affects both heart and lung health. Environmental risk factors are hazards in our surroundings that increase our risk of developing NCDs. Air pollution, both indoor and outdoor, significantly contributes to respiratory diseases, lung cancer, and cardiovascular problems. The WHO estimates that air pollution is responsible for millions of premature deaths annually. Workplace exposures to chemicals, dust, radiation, and other hazardous materials are linked to various cancers, respiratory conditions, and other health problems. Certain industries have higher risks of specific NCDs. Non-modifiable risk factors are aspects we cannot change but must be aware of to understand our complete risk profile. Age is a major risk factor for most NCDs. As we get older, cellular damage accumulates and our bodies become less efficient at repair, increasing disease risk. Genetics play a significant role in NCD risk. Certain genetic variations can increase susceptibility to diseases like type 2 diabetes, certain cancers, and heart conditions. Family history often indicates shared genetic and environmental factors. Having close relatives with NCDs like heart disease or cancer increases your personal risk. The good news is that addressing modifiable risk factors can have a tremendous impact on disease prevention. Research shows that addressing modifiable risk factors could prevent up to 80% of heart disease, stroke, and type 2 diabetes cases worldwide. These four modifiable factors: tobacco use, physical inactivity, unhealthy diet, and harmful alcohol use, have the greatest impact on NCD prevention and should be primary targets for both personal and public health interventions. Prevention strategies are crucial in reducing the global burden of non-communicable diseases. Prevention strategies fall into four main categories: health promotion and education, creating supportive environments, policy interventions, and encouraging healthy individual behaviors. Health promotion and education campaigns are essential for raising awareness about NCDs and their risk factors. These include public awareness campaigns, school-based education, community outreach, and digital health platforms. Creating supportive environments makes healthy choices easier for people. This includes providing accessible recreational spaces, implementing workplace wellness programs, establishing smoke-free zones, and ensuring healthy food options in schools. Policy interventions are powerful tools governments use to influence health behaviors on a population level. These include tobacco taxes and plain packaging, alcohol minimum pricing and age restrictions, and food labeling requirements and sugar taxes. These policies can lead to significant population-wide improvements in NCD risk factors, with tobacco interventions showing the highest impact. Individual health behaviors play a critical role in NCD prevention. The four key behaviors include regular physical activity, balanced nutrition, avoiding tobacco products, and limiting alcohol consumption. Health guidelines recommend at least 150 minutes of moderate exercise weekly, 5 or more servings of fruits and vegetables daily, complete avoidance of tobacco products, and limited alcohol consumption. Prevention strategies for NCDs are significantly more cost-effective than treatment. On average, prevention interventions cost around $5,000 per quality-adjusted life year gained, compared to $15,000 for treatment. Studies consistently show that prevention strategies are approximately 3 times more cost-effective than treatment approaches for reducing the global burden of non-communicable diseases. The growing burden of non-communicable diseases requires coordinated global action across multiple sectors and stakeholders. Currently, 85% of premature NCD deaths occur in low- and middle-income countries. NCDs are responsible for over 41 million deaths annually worldwide, with 15 million people between the ages of 30 and 69 dying prematurely. The World Health Organization established the Global Action Plan for NCDs with the ambitious goal of a 25% reduction in premature NCD mortality by 2025, known as the 25 by 25 target. This comprehensive plan focuses on key areas including reducing exposure to risk factors, strengthening health systems, monitoring trends, and promoting research and development. Strengthening health systems is crucial for addressing NCDs, particularly in low- and middle-income countries. Effective health systems require robust primary care access, trained healthcare workers, availability of essential medicines, functional data systems, and sustainable financing mechanisms. There must be a priority focus on low and middle income countries where the burden of NCDs is growing most rapidly and resources are most constrained. Emerging technologies and innovations are revolutionizing how we address NCDs globally. Mobile health solutions, artificial intelligence, wearable devices, and telemedicine are expanding access to prevention and care services, even in remote areas. These technologies are transforming how we approach NCD prevention, early diagnosis, and management, making healthcare more accessible and personalized. Addressing NCDs is essential for achieving the Sustainable Development Goals. SDG Target 3.4 specifically calls for reducing premature mortality from NCDs by one-third by 2030. NCD prevention and control supports multiple development goals by reducing poverty and inequality, promoting economic growth, strengthening health systems, and advancing gender equality. In conclusion, addressing the growing burden of NCDs requires global coordination and cooperation, multi-sectoral approaches, equitable access to healthcare, and substantial investment in both prevention and treatment. Together, we can reduce the global burden of non-communicable diseases and create a healthier future for all.